Physiotherapy helps to get people moving. Physiotherapists provide assessment and treatment to those who are suffering from impaired movement for many different reasons.
In my role as a physiotherapist, I deal with injuries, so that's pain and problems with moving, but then there are other physios who deal with neurological disorders and children and even animals. Physios work in a variety of different workplaces. There's private practice settings, which is a lot of individual rooms where patients come on a one-on-one basis. There's classes, typically a Pilates class, where you'll have a group of patients with one physio. And then there's hospital environments as well, where physios will be working on the wards, going and seeing patients at the wards, or they'll be running hydrotherapy classes or something like that as well. And physios also work in non-physio roles, such as teaching and administration and government type jobs as well. My average day involves a lot of time with patients. So I'll have patients coming in with a variety of different injuries. Sometimes I'll be seeing them for the first time on that day, so I'll have to assess what's going on with them and make a diagnosis. And then I'll have patients who are coming back for a follow-up appointment, and so there'll be treatment involved, which is a variety of moving their joints, doing things with their muscles, nerves, all of that sort of stuff, some massage and giving them some exercises to do. That's the majority of my day. In addition to that, I'll be writing notes, writing letters to doctors, having a chat with the podiatrist about his opinion about certain things, making phone calls and ordering products for my patients as well. Physiotherapy is a good career because it involves a lot of people contact, so you're spending a lot of time meeting heaps of different people and helping them to achieve something that's quite relevant to their everyday life and relevant to all sorts of people as well. Nobody likes to be in pain or unable to walk properly, so if you can help somebody to get over that, then it makes a big difference to them. To become a physiotherapist, you'll need to finish your high school with a relatively good OP score, and then you'll move into a 4-year bachelor's degree, which will include all of the clinical work and experience and everything that you need to, by the end of that degree, be a fully qualified physiotherapist able to start work. Alternately, you could do a different undergraduate degree before moving on to a postgraduate 2-year physio program, coming out with a master's of physiotherapy, and again, including all of the clinical work that you need to then be qualified to work as a physio. The personal attributes required for this kind of work is primarily that you're able to have a conversation with people and get information from them and explain things to them in ways that they'll understand. You need to be quite good at problem solving and picking up lots of different information and integrating it into a whole and forming a plan with the information that you've gathered. Things that I really enjoyed about studying at UQ were the campus and the staff that work here as well. So all of the lecturers here tend to do a combination of lecturing, research and clinical work. So they're having continuing experience working with patients, and then they're also developing their knowledge and developing the knowledge base of physiotherapy as a profession with all of the research that's conducted here. So UQ physiotherapy has quite a good reputation within Australia and also overseas for that very reason, that there's a lot of research relevant to physiotherapy and that's developing physiotherapy that's happening here.
The thing I love most about studying physio at UQ is the people we're learning from. So our lecturers are world-class researchers. They're the ones writing the textbooks that we learn from. They're the ones who write the papers that we're learning from. So we know that the information we're getting and what we're learning is the forefront of physio. The facilities from a physio point of view are fantastic. The different things that we use as physio, so equipment and electrotherapy equipment, massage therapy equipment, is state of the art because the researchers use it at UQ and we have access to it as students. It's the best that we could possibly get. And then as far as the actual campus itself, it's a beautiful campus. It's a great place to learn. Coffee shops and the lolly shop and restaurants and things, they're all around and it makes it a really nice place to be able to both learn and just relax at.
UQ's Bachelor of Physiotherapy ensures graduates are well equipped for this vital health role that helps keep people moving. To find out more about studying health at UQ, visit UQ's study website, uq.edu.au/study, and click on Health.